like to explain it as if we've got a garden hose. If you step on a garden hose while the water's flowing through it, what's going to happen to the hose?
Hey, Mama Bear. Welcome to the Breastfeeding with Confidence podcast. Do you dream of bonding with your baby through exclusive breastfeeding, but worry about breastfeeding pain or low milk supply? Maybe you're struggling with breastfeeding and no one seems to have any answers. I'm Jamie, doula, international board certified lactation consultant, and mom of 5, and I have been where you are. After working through painful latches, milk supply worries, and postpartum depression, and supporting countless mothers through their breastfeeding journeys for over 8 years, I'm here to tell you breastfeeding doesn't have to be perfect to be positive. Each week, I'll share breastfeeding tips to help you prevent and overcome unexpected breastfeeding challenges so you can actually enjoy bonding with your baby. If you are ready to shut out the toxic whispers of the world, embrace your God-given intuition, and release your inner fierce mama bear, grab some coffee or your favorite herbal tea and let's dive in. All right, so we have Catherine here with us today, and we are discussing therapeutic ultrasound, specifically regarding mastitis, breast ultrasound, and I'm very excited to learn all about this. So Catherine, can you go ahead and tell us a little bit about yourself, what you do, and why you do it?
Amazing. Thank you, Jamie, for having me today. Yes, my name's Catherine. I'm a physiotherapist. And right from when I was a young, 18, 19-year-old, I loved working in the women's health side of things. I think in my first year of university, I did what all physical therapists, or physiotherapists, as we say in Australia, did what we all do, which is going to do football training, where you work on the football field and you help massage sweaty hamstrings. And I think it was in the middle of winter, and I was massaging this muddy, sweaty hamstring, and I thought, this is not for me. This is not what I thought physio was cracked up to be. So my first placement was in a women's health clinic, and I fell in love with this area of women's health that was under-recognized, under-treated. Like, now, as a women's health physio, I love helping women prevent issues before they even come, with, speaking to people like yourself on the podcast, because it can make such a massive difference, as you know, to not have pain or not be leaking or yeah. So it's something I love. And since having 3 children myself, my love's grown with it all. It's a beautiful area to work. I'm very lucky.
That's awesome. I have had a couple other physical therapists on, all with different disciplines, right? We've got one who we talked to, Becca. She focuses on pregnancy, pelvic health in pregnancy and postpartum. And then I just spoke with a physical therapist who focuses on infants and helping them reach their milestones and like recognizing red flags. And I think it's so cool to see how within physical therapy, there's so many disciplines, even just within the maternal space.
Oh, absolutely. I was blown away. Like, I had no idea that there's so many different areas of physical therapy. It's fun.
Until you find it out. And it's so good for moms to hear that, because if you working in that field, wanting to go into that field, didn't even know how many options there were, why would we normal people know that these resources are out there? So I'm really excited to talk about this today. And you had mentioned that, you had mentioned pain and that you don't have to be in pain. And this is kind of a resounding message that I share, that a lot of the guests who come on share, is pain is a sign of a problem, and some discomfort can be within the realm of normal as we go through changes and shifts, but pain should always be acknowledged and investigated. We should not sit there saying like, oh, pain is normal, just let it go. There's nothing you can do about it. Just wait it out, because things just get worse. So tell me more about this therapeutic ultrasound, and when, what kind of pain you see this helping. What does the therapeutic ultrasound do? When is the best time to look for or utilize it? And how can moms advocate for that option? When do they know that's an option they should be looking for?
Yeah, absolutely. So I guess, so that everyone's on the same page, it'll be good to just briefly mention mastitis and inflammatory breast conditions, because there's been a real shift lately where mastitis is one of a number of inflammatory breast conditions. And as you know, as a lactation consultant, but mastitis is inflammation of the breast tissue and often is due to that milk stasis or infection. So it can present with local symptoms. And when we talk about local symptoms, we're discussing, more the pain, the redness, the heat, the swelling, the lumps, that sort of thing. And then it's also got the potential to have systemic symptoms, which is more the flu-like symptoms, fever, fatigue. So it's a spectrum of conditions where it might start off as engorgement, go to milk stasis, inflammation, and move to blocked ducts, mastitis, and then even might progress to abscess or sepsis, those more severe conditions. So it's a bit of an umbrella term, the inflammatory breast conditions, which incorporates all those terms that you do here. And yeah, as a role of physiotherapy in this area, it's really nice because obviously there's the lactation consultants that are so important with helping with the breastfeeding advice, and that's paramount with these situations. But women's health physio, well, all physios have used ultrasound for quite some time for different issues around the body. So let's say it might be used for carpal tunnel syndrome with the wrist and some wrist pain, some inflammatory issues like tendons with ankle and
when I was in high school, I had ultrasound therapy on my neck, actually, because the muscles right in here, people can't see me, but the muscles right in here, I just have like ongoing tension there. It's kind of been an ongoing issue my whole life. And this is kind of off track, but they said that the damage to my muscles appeared as if I had been in a severe car accident, and I hadn't. That's how much tension there was. And the ultrasound, I truly believe, was like paramount in releasing that and helping with that. So when you shared this topic with me, I was like, this is not something people talk about enough. So I'm definitely interested to see how it works with mastitis.
And I guess it's a shame that it's not, well, we'll probably go into this, but the reason it probably isn't talked about as much is because not many people just have an ultrasound machine sitting around, sadly. And it's not the same ultrasound that you use, for scans when you're pregnant. It's what we call therapeutic ultrasound. And I can't get into technical side of things because I don't know it, but it's a different, they're still using sound waves to generate an image versus the therapeutic side of things, but it's a different type of sound wave or different size sound wave or something like that. So the way the therapeutic ultrasound works, it's a non-invasive modality, and it uses, as I mentioned, those sound waves, and those sound waves helps to promote tissue healing. It helps to reduce inflammation. It helps to improve that milk flow that we talked about. And interestingly, there's some new evidence emerging that it might potentially disrupt like the bacterial biofilms. So it might help, it's help make antibiotics more effective or reduce the need for antibiotics. So it works via two ways. And again, I'll just be really quick because we don't want to get too technical, but it's got the mechanical effects where the sound waves produce almost like it's a cavitation, like a movement within the tissues, and that supports the milk movement and tissue healing. And then it's got the thermal effects if it's in continuous mode. So that's where the heat increases blood flow and tissue metabolism, improves the drainage and reduces pain.
Can we talk about that for just a second? Because I know a lot of advice or recommendations with mastitis now are leaning toward like avoid heat at all costs. You only want cold. And I always kind of lean in there's a balance to be had, because yes, heat increases inflammation, but it can also increase that flow. It can bring the milk or the blood to promote the healing. So I've personally always been I always give the advice that we're going to use the heat and ice in combination, where we're going to use warmth, promote the movement, and then use cold to follow up. So do you follow that same advice?
Yeah. Look, that's the same advice I do. And from what I believe, and let's just be honest, research in general as it is in its infancy, but especially in women's health, um, we're working off pretty small studies, randomized controlled trials. So, like, I just went to a research update just at the end of last year, which is where a lot of this information is coming from. But if I go, or when I go to another research update, which happens annually, my advice we might be having a different conversation. So,
Mhm.
but at the moment, I'm the same as you, Jamie, where I advise warmth and heat first before the feed, because it's not that it's not that the research doesn't state that it's going to do any harm. It's just saying that they don't think it's potentially effective. But again, we take research with a grain of salt, especially some of this research we're presented with. But this particular, it does no harm. So let's try the way that we generally advise at the moment, given the level of research, is heat first and then feed or ultrasound, and then follow it up with ice. So
Yeah.
so heat, feed, ice.
Yeah, I think some people tend to get a little too rigid in their recommendations. And I'm like, recommendations are always changing, and we have to be so careful not to cling
Yeah,
to new evidence too, just because, just because we have new evidence doesn't necessarily make the old evidence bad or irrelevant. We have to find a way to blend them together.
yeah.
So that's kind of where I come from as well.
And we know that the heat is safe, and
Yeah.
we know it's safe. So that's amazing. It's not going to do any harm. So yeah, and yeah, it's. I wish we had more research, but heat, feed, and then definitely the ice. And way to do the ice, it's interesting. I was speaking to a breastfeeding doctor, and we were discussing, do you ever suggest an ice massage, a very gentle massage with an ice cube, or do you suggest an
Oh,
ice pack?
I
Like,
usually have just thought the cold packs. I have
yeah.
not ever thought of doing massage with ice, and that actually makes sense.
Well, yeah, because when someone comes in for therapeutic ultrasound, I we'd assess them, we'd do the ultrasound, and then afterwards I teach them how to do lymphatic drainage. So
Mhm.
that would be the next step. And it's really interesting because ice, if done in a certain way, it's very light. Like, you never put ice directly on skin
Right.
we don't want to cause an ice burn because it can get very cold. But when there's a layer of water underneath, there's a sort of barrier, and you're continually moving it so it's melting on the skin.
Mhm.
That can be very light. It's like that stroking, that lymphatic massage. So yeah, it's interesting. More people I speak to are suggesting that. So I was interested to know whether you
Yeah,
suggest
I
ice massage.
I haven't heard of that yet. So you're basically doing lymphatic drainage massage with an ice cube.
Yeah, well, yeah, it's a little bit different. I wouldn't substitute it, but I do it. It's that light touch.
Okay.
You're not digging it in. It's that very
Yeah.
light flow, and that's part of what they're wondering is this what's helpful with the ultrasound machine? Because what we do with the ultrasound machine, you've got the head of the ultrasound, you pop the gel on, and then you're doing figure 8 movements, and you're doing continuous circular movements around the area that's impacted. And it's that very light, it's like that stroking sensation, which is what that lymphatic drainage
Mhm.
is essentially. So this is also where we've shifted our advice away from, getting that. Like, when I first gave birth, this was 13 years ago, it was much more common to recommend getting the thumb in and really massaging out that lump
Yeah.
and getting in deep until it hurts. And whereas now it's that lymphatic drainage, which it's really interesting how things change. But it totally makes sense, because the way I like to explain it is, if we've got a garden hose, if you step on a garden hose while the water's flowing through it, what's going to happen to the hose?
It's gonna stop flowing.
Yeah, and it's going to back up behind, and it might start spurting out the other end if it becomes
Mhm.
disconnected from the tap. So whereas the lymphatic drainage, they're such small little delicate ducts, aren't they? And that
Mhm.
and because the issue is more of an inflammatory issue, not a blockage issue per se, the lymphatic drainage really helps with the clearing of those lymph, which are sort of pushing that garden hose down.
Yeah.
Yeah, that's generally what we do, is the therapeutic ultrasound, that beautiful lymphatic drainage where it's that broad sweep from the nipple towards the armpit. And I know this is a podcast and here I am on my screen. Yeah, it's fantastic. It's amazing the outcomes as well.
Yeah.
Yeah.
So where I know you're in Australia, so based off where people are, there might be some different processes around it. Is it typically physical therapists who do that? Is it typical to find in a OB clinic? Where do people go if they're like,
Mm.
I'm having recurring mastitis and I want to try this?
Yeah. Well, I guess this is the issue because it's not like, I don't know in America, but there's a pretty long wait list these days to go see a women's health physio. Like you can't necessarily just, if you wake up with mastitis, let's say it's a Sunday, everyone's closed and it's not necessarily that easy to just call up your local physical therapist. So here in Australia, we have them privately. We do have them in, obstetrician clinics, but it's very much jump on Google and Google your area and
Mhm.
physical therapist, women's health physical therapist, because not all therapists will do this. So it's worth, before making an appointment, calling up reception if you can, to just double check they treat women with mastitis.
Mhm.
Um, yeah, and that's often the tricky part, is finding an appointment in a timely manner. And I know we're often, because we can't, it's not like someone with mastitis can just wait a week or 2 weeks for their appointment. So we often try to squeeze women in, whether or not it's at the end of the day or, in a lunch break, because we know women with mastitis really do need it, and sooner
Yeah.
rather than later. This is where, if women like listening to this podcast, they're now more likely to identify those symptoms, you can then jump onto treatment sooner
Mhm.
to hopefully avoid that full-blown systemic mastitis where you've got the fever, the full, body aches and pains. Because once it gets to that stage, absolutely, you probably need to go see your doctor and see if
Yeah.
they recommend antibiotics, because it's full systemic. So we're talking, like, if it's the localized pain, lump tenderness, that's where, if we can jump in early with these treatment strategies, it can really help prevent that full-blown infective mastitis.
Yeah, yeah. Mastitis
Mm.
is nothing to mess around with, but it's also
No.
one of those things where it's kind of like you said, it's like if you catch it early, you can do a lot. You
Yeah.
really can. And I probably should be doing an episode on that. I don't think I've done an episode on that yet.
Yeah, and interestingly, Jamie, you had it with your fifth. You were probably pretty tired, pretty run down, and
Well, it was actually a really strange situation. So I only nursed her on one side because I had trauma to the other side. And so that side would just like leak once in a while and it was fine. Well, I allowed her to try nursing on that side. And because of the previous trauma, she like tore an adhesion,
oh,
which got infected. So it was a very unique
okay.
situation. It was
Yeah.
it was very unique. And it was one of those things I just kind of ignored it until
Yeah.
it got really bad and I was like, what's
Yeah.
happening? So it,
Oh,
it was
shame.
definitely a unique situation, but I can't help but wonder if other like if the or
Mm.
the ultrasound would have been more helpful in the early days if I
Mm.
had gotten it sooner.
Yeah. Um, yeah, absolutely. If only we could had that hindsight.
I know. I know. It was a crazy situation. It was a very unique, like most people listening will not experience mastitis the way
No.
I did.
Yeah. But I do think it's valid to bring up the fact that, and always remember being thankful of my GP. I was with my third bubs and they said, you're now a mum of 3. Like, try to rest. I know this is silly to say, but try not to get run down, try to sleep, because that's when mastitis is more likely to rear its head and come about. And it's so true. One of the best things we can do, it's almost as if it's our body's way of saying, slow down, slow down.
Oh,
And if
absolutely.
we ignore that, then boom, we're going to be in a fever and then we're going
Yeah.
to have to slow down. It's like going to be that forced rest. So
Absolutely. And I have found that a lot of women who have mastitis, or especially recurring mastitis, they have other inflammatory conditions throughout their
mm,
body. Like they might be dealing with inflammatory bowel situations. There's
mm,
other red flags that
mm.
they have, just general systemic inflammation that often does make them more susceptible.
Oh, interesting, isn't it?
Yeah.
That would be a
Yeah.
good area to study.
Yeah.
Bowels and mastitis.
Yeah, there's a lot of
Yeah.
there are some lactation consultants who specialize in like gut health and how it impacts the breast
Mm.
microbiome
Yeah.
with the whole
Yeah.
microbiome. And it's a very layered conversation, and it sounds simple, mastitis,
Uh,
but there's so
yeah.
many angles to it.
That's right. And probiotics for mastitis is becoming, again, research is in its infancy, but this is a really interesting growing area. Watch this space. Yeah.
It really is. Is there any time that you should not use ultrasound, or any risks that come with using ultrasound?
Yeah, absolutely. Great questions. As we mentioned, ultrasound can be amazing if there is suspected inflammatory mastitis, so that, local pain, swelling, redness, or blocked ducts. And you want to prevent escalation into infective mastitis or even abscess. But there are a few precautions. So we need to avoid it if there's any metal implants, like pacemakers, obviously any known malignancies, but also any like the breast implants too. That would be definitely unless the obstetrician has specifically said it's okay with this type of breast implant, that would be a no for me to do ultrasound. Any open wounds, bleeding, and if there's poor sensation to the skin. So that's just when contraindications, when mastitis might not be appropriate, sadly.
Or therapeutic ultrasound would not be appropriate.
Yes, therapy. Yep.
Would with the implants, is that because the heat can cause them to degrade? What is, I'm just curious.
Yeah, I think again, there's no research to show it's safe, and
Okay.
we're just yes. So absolutely, there's that potential risk for degrading of the implants, which I think no one wants to go there. How can we even study that, research that?
Oh,
Do you
for
know what I
sure.
mean? So this is sad. Yeah. But metal attracts heat. So with the metal implants, it could cause
Hmm.
burns. So that's why we avoid it with metal implants. I think the breast implants, it's a bit more of a grey area. That's why we would get the doctor's approval, maybe even the surgeon who's done the implant. Like, yeah. So
Yeah. Do you, I don't know this off the top of my head, which I probably should. Do you know if there's an increased risk of mastitis for women who have breast implants?
I don't believe we've got that research information.
Yeah,
Yeah.
as you were
Yeah.
saying it, I just thought about it because I know that there are some people who have implants that deal with inflammatory responses to those implants, and then just
Mm,
implants can cause challenges with milk production based off the type of surgery that was
yeah.
performed. And so I'm curious if there has been any research on that. That's something I'll have to
Yeah.
look into.
No. Yeah, but I will. Yeah, it's a really good question. I don't believe from all the recent research updates I've done, there's been nothing to bring that up. So, but yeah, I'll definitely.
That's a question
Good question.
we should look into that.
Yeah, why don't you do a research study?
Because I'm way too busy.
Leave that for someone else.
Yeah, no, that would be a good idea. Something
Yeah.
interesting to
Mm,
look into. We gotta think about that.
yeah.
Um, is there anything else you want to cover before we continue?
No, I think that's the main thing. So yeah, it's it's really commonly used in Australia. I don't know about America, but up to 90% of a recent audit showed that women's health physios that treat mastitis clients are using ultrasound. So
That's really
it's got,
amazing.
and the other brilliant thing is it's got very like the adverse events are really rare and minor. So maybe there might be a little bit of warmth, but no lasting issues. So it's been found to be really safe and in
That's
this women.
Yeah, I know. I have heard of some people doing it here, but I don't think It's definitely not a go-to. People are like, we're going to do
Mm,
therapeutic ultrasound. It's one of those things that's kind of like, yeah, if you know somebody, if it's available in your area, which it
yeah,
probably
right.
isn't. Um, but that would be really interesting to see how frequently it's being used here. I think a challenge with it here is, and I don't know the health system there and versus the health system here, how it's designed, but it is so difficult to get referrals for things. And then you get a referral and you're waiting, like you said, for
Mm,
weeks to be able to get that. So yeah, we need referrals for physical therapy here.
that's unbelievable.
Yeah,
Yeah, there you go.
it's probably not all in all situations. I think it's based off certain insurances, but I have
Yeah.
with my one of my children for getting speech therapy, I was going round and round because they wanted referrals to book the therapist, and I was like, I want to pay out of pocket. Like I don't want to jump through hoops. I'm going to pay out of pocket.
Mhm.
Like let's just do this. And a lot of the people I spoke to were like, we can't do that. We need a referral still. And I did find somebody who was in a private practice who was like, absolutely, we can do that. You don't need referrals. So I think
Mm,
it's very much is the practice part of a larger health system? Is it
mm.
like there's a lot
Yeah,
of nuance there that it's
yeah.
very difficult to get in with specialists without having a referral first. And then if those specialists even offer it, and then when you do get in, there's
Mm.
a wait time of
Yeah.
weeks and weeks, like you said. I don't know what the regulations are on who can perform ultrasound. I think that's a different thing because I know there are chiropractors who have been trained in ultrasound therapy and do that for things like muscular
Mm.
situations. So I don't know if there's a
We
potential there that somebody who's
Yeah,
treating if
yeah,
they could start doing that, and somebody who's already treating pregnant women and postpartum women could introduce that. That's
yeah.
yeah, I really don't know what the regulation around it is here.
Well, I think it probably starts off with demand. So if women start calling their local, physical therapists and chiropractors who do ultrasound and say, "Can you help me?" Then that's the first step, isn't it?
Yeah,
Yeah.
absolutely. Just talking about it. And that's why it's good that we're doing this. So moms
Yeah.
can hear this and say, like, look, there's this option. Who provides it? Let's start asking for
Yeah.
it.
Absolutely. And above all, we know it's safe. We know it can be really effective potentially. And we know it's not a systemic treatment. It's not like taking antibiotics. So it's a win-win. Do you know what I mean? It's
Absolutely.
yeah.
Absolutely. So if people want to learn more about your education offerings, what you do, where can they find you?
Yeah, absolutely. So I work clinically in Australia, but I do have an online program which supports women during pregnancy and postpartum with their recovery. So helping women, like I know a lot of breastfeeding mums get really achy and sore and the neck pain and back pain from all the lifting and carrying and all those heavy demands of motherhood. So I help women recover confidently after having a baby with the online physio-led workouts. And I've got a podcast too that you're going to be a guest on very soon.
Yes.
So that's called the Pregnancy, Birth and Recovery Podcast.
That's so great. Thank you so much. I am so excited just to hear about all the different resources. And it's always great to talk to somebody from a different country who has a different perspective on how these things work and to hear what's
Mm.
common there. And
Yeah.
so I appreciate you coming on. It was so nice to chat with you.
Thank you. You too, Jamie.
All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.